Okay, hi everybody. Dr. Brian here. I just want to remind you, do you guys remember this thing that I drew out for you? Mostly the new patients drew this out for you recently. That was the soft tissue diagram, we call it. And it said it takes at least a year for soft tissue to heal properly. So if you are stopping care after your initial program, and you have to consider how long it took for your spine to get into the shape that it was when you first presented in my office. You know, if you stop, what do you think is going to happen to that momentum? So you may be feeling better, but that was only part of the goal, part of the picture. So if your spine is used to being out of alignment for so many years before you came in here, the average age of a person coming in is 40 years old, what kind of shape your spine is going to be in. It's like a person that never saw a dentist in their life before, never brushed their teeth, knew anything about dentistry. They go to the dentist for the first time at 40. Are they going to have any teeth left? So what's the idea of continuing on after your initial program? Or I've been getting adjusted since 21 years of age. I'm 60 years old now. I go weekly. So why do you want to continue? Well, you can get more correction. The body takes time to heal when you're working with the spine nervous system. It's preventive, proactive. You don't want to regress and go backwards, right? I mean, you know, if you take the braces off your teeth, let's say you wear braces or whatever they are these days, Invisalign or something. Let's say you take the braces off your teeth too soon, then what's going to happen to the teeth? They're going to get all gnarly and crooked again, right? So you go to a gym, you want to get stronger. Let's say you want to lose weight. And then you stop, well, what do you think is going to happen? You're going to gain that weight back, most likely, and you're going to lose the muscle mass, things like that. So we start brushing our teeth, we floss our teeth, let's say, and then we go to the dentist, and we know about dentistry this time, but we've passed with flying colors, no cavities. So then we stop brushing our teeth. Now, nobody's going to do that. So we have to get educated people about why the spine, why the nervous system. It's beyond back pain. It's much more than that. And so we want to keep stabilizing you. So there's no time off, really. Now, there was a study done in 1987, Dr. Tapio Vitamin. It said experimental models of osteoarthritis, the role of adjustments. This was published in the Clinical Biomechanics Journal in 1987. He said, when immobilization occurs, so let's say your spine's still out of alignment or it's still not moving exactly the way it's supposed to, that's called a subluxation. And it's in a joint and remains there for more than 10 to 15 days. The joint begins to degenerate. So like a car that's out of alignment, the tires, the wheel alignment, the tires wear out unevenly, abnormally, that's tires. But what about your joints? What about your spine, your discs? And then affecting the nerves inside that spine. So if you're on maintenance, the average patient in our office for years, they've been coming once every 2 weeks. That's what most people do. We have a few people that come once every 3 weeks to once a month. And they see the value in that. So yeah, of course there's cost, there's time that's involved, but you must invest in your health. You must take back control of your health, and this is one of the tenets, one of the specific things that you need to do to help yourself maintain your health, maintain your well-being, and maintain your life and enjoyment of your life, especially as you age.